Dr. Mishal Reja, welcome to ITV Gold. Thank you so much for giving us your time today.
Hi, thank you so much for having me again.
Of course, we have to have you because I have a lot of questions, so let's go right into it. My first question has to be about the high case numbers that we're seeing across the nation in several states, as well as high number of deaths as well. How are you currently observing these numbers that are coming in this country right now?
Look, we watch the news and we know what's going on, but personally, I've got to say, in the hospital, day in and day out, what I see is more patients, sicker patients, lots of rooms with the caution, COVID-19 patient, lots of precautions, lots of places closing down. It's hard. None of us expected it to really, drastically go up this much, but it's so present, it's so prevalent. We all feel it. Travel restrictions are going up again. States are shutting down again. So it's everywhere.
Right. So you weren't surprised by the surge, or were you surprised?
It's tough to say. I'm a little surprised because, the rhetoric with the government and the CDC was that, COVID-19 is over, we can start to go maskless. But at the same time, none of us could have predicted this deadly Delta variant that really originated in India after mutating and then spread here. It's a result of our poor vaccination over there, but at the end of the day, it is what it is, and we're facing what we're facing.
Right. So let me ask you this question. Do you think we're all in trouble? I ask you this because, rates over here in New York where we are still high of vaccination, whereas in the South and Midwest, they're not. How are you comparing these different areas of the country?
Yeah. So what we see specifically is that areas with lower vaccination rates, in Florida, and some of the Southwest, have some of the highest rates of COVID hospitalizations and deaths right now. So are we all in trouble? No, because right now, universally, almost 70% of the United States population is vaccinated. There are areas like New York that are doing better than others. But I just want to mention that if you are unvaccinated right now, you're in trouble. And what I mean by you're in trouble is you're in trouble for the risk of a severe hospitalization where you could be intubated, where you could not survive, and death. So that's what I want to focus on. If you don't have a vaccine, if you are not vaccinated right now, you're in trouble no matter where you are. But if you're fully vaccinated, the chances of you getting COVID, spreading COVID, getting severely hospitalized is extremely low, almost none.
Let's talk about these hospitalizations a little bit. We're seeing children and adults under the age of 50 hitting the highest levels of hospitalizations we have seen so far in the pandemic. Why do you think that is happening right now?
It's the population that didn't want to get vaccinated, unfortunately. And it's one thing to watch it on the news and see these young people getting hospitalized, but we all have brothers, sisters, uncle, aunts that are, less than the age of 50, and we see them, getting sick and hospitalized. It's a deeply personal issue. And the reason it's happening is because this is the population that didn't want to get vaccinated. Now, we're past the point of, laying blame or anything like that. What we need to do now is try to encourage as many people as we can to get vaccinated. We need to protect our own family and our own friends and our own community so that they aren't the ones that are going to be hospitalized and die.
Could you provide our viewers a picture of what's happening in certain hospitals across the nation that are reaching capacity? I'm sure you have colleagues or friends in these states that are working on the front line. What are you hearing?
That's a great question. So first, I'll give you a personal perspective of what it's like for me, and then I'll tell you what it's like in the broader United States region. So personally, one of the hospitals that I do work in is a very inner city hospital in an area with high unvaccinated rates. So we're seeing lots of COVID hospitalizations, lots of people in stretchers, lots of people that are intubated, and lots of people that don't make it. And it's so sad watching these people get hospitalized and their families that have to deal with, watching their loved ones sick. And now when we spread out into the United States, into other states such as Florida or the Southwest or some of these states with lower vaccination rates, they are out of ICU beds. They're packed with kids and adults. The hospitals, the doctors and nurses are severely understaffed. Medication shortages are coming up again. Nurses are burned out extremely, and so are doctors. So it's almost like we were almost a year ago, and we need to, straighten this out. We need to get back on track to where we were a couple months ago before the Delta variant hit. The thing to remember is the Delta variant. So the Delta variant is a mutation of the original COVID strain, and it is more transmissible and more lethal. So the population that it's affecting them even harder. So around the United States, we are seeing sicker patients, higher death rates in these pockets of unvaccinated individuals. The situation right now, it's bleak. It's not a good situation. And it's also under the umbrella of people also want to go out. We've been through, how many years of this? We want to, send our kids to school. We want life to resume normally. So much of the population is vaccinated. Mask mandates are flip-flopping, wear it one day, don't wear it another day. So it's a tricky time, but that's what the situation is around the country.
Right. And, when we are looking at these states that have high vaccination rates, do you think the Delta variant will eventually catch up to these states? Because, we're hearing of dire situations in other states that don't have high vaccination rates.
Yeah. The good news with this whole bleak picture is if you are vaccinated, chances are you're protected against the Delta variant. Now, what the vaccines, the original intent and the original purpose was to prevent severe hospitalizations and to prevent death. And it also helps with transmissibility. So you can still get some breakthrough infections. You can still get the virus, but your symptoms might just be like the common cold and then they go away and the lingering effects are almost nil. So will it catch up to these high vaccinated populations? The answer is no. But at the same time, you need enough of the population to be vaccinated to reduce the spread and transmissibility in the community. So there is something called herd immunity. So if you have, extremely high vaccinated populations, likely they're going to transmit it less and less to each other because so many people are vaccinated. Now, if you have like a 50% vaccination community, chances are the transmissibility is going to be pretty high. So the Delta variant will catch up to those communities. So we just need everybody to be vaccinated as soon as possible. And you can't rely on, hey, all my neighbors are vaccinated, I'm not vaccinated, so it's okay. You gotta go ahead and get it yourself.
Let's talk about these vaccines a little bit more, Doctor. FDA just approved the Pfizer vaccine. It has full authorization to be used as a vaccine in this country. It's no longer for just emergency use. What kind of a difference do you think that makes? And I keep on hearing that now certain businesses, healthcare professionals, like offices, can require a vaccine mandate because of this full approval. Could you explain that process to us?
Yeah. So first, let me explain what exactly an FDA authorization means, because I know we hear this term in the television, but I'm not sure that confidence is being translated into the Indian community. So what FDA authorization means is they went through hundreds and thousands of pages of data, inspecting everything from the efficacy to the side effects to the adverse effects. And then after that, they go into the plants and they inspect it. It is the most thorough, rigorous review process that exists in this planet. And if it was not safe, they would say it's not safe. If there were any risks, they would call out the risks. And if there was benefit, they would authorize it. So what it shows is that the FDA has an authorization that it is effective and it is safe to get. So what that should instill in our community is that it's safe to get. It's safe to get for your kids. It's safe to get for your children and everything like that. So it's safe. Now, at the end of the day, I know that for the Indian community, just hearing a bunch of people on the television say it's authorized right now, if you're initially resistant to it, you may still be resistant to it. But I just want to tell you personally that, with the emergency youth authorization, with this now final approval from the FDA, I'm completely confident in my family, in my parents, in my kids. And I've reviewed the science and I know what it's about, and I see patients get sick, and I encourage you to get it. I implore you to get it, because you're going to be keeping yourself safe. I've seen death. I've seen the people that die. I've seen the people that get sick. And one of the major regrets that they have is they constantly say, hey, I wish I got the vaccine.
Yeah. That's so important for all our viewers. Vaccines.gov is the website in case you were looking to get that. More on vaccine, doctor. Of course, last week and this week, the news continues on booster shot. They're saying after 8 months of getting your second dose of the COVID-19 vaccine, you should get another dose. How are you looking at this? And should we be worried right now that our immunity is waning off and we are in perhaps more danger with this Delta variant? How are you looking at all of this?
So right now for the general population, you're fine. If you didn't get your booster shot and you got your vaccine in time when it was your turn, you're fine. And you don't have to worry about a booster shot just yet. Right now, the people that are going to have to worry about it are people that are immunocompromised, meaning they have low immune levels, and so they have less ability to fight back, and healthcare workers who initially got it at the beginning of the wave, and now it's their turn to get it again.
Right.
So what it shows is that these vaccines, the strength of it does wane after a period of 8 months. That's what the preliminary data is telling us. So it's just good to know at this point that eventually this might be like a regular thing until COVID, really itself goes away, that you might need a booster shot. It's not your turn now, and I don't want anybody skipping the line to get a booster shot because that's the wrong thing to do, and you don't need it right now. But when it's your turn to get it, when the data suggests that it's okay for you to get it, then then it's going to be announced. Okay, so right now it's not something to worry about for the general population.
So for people with underlying conditions or just concerned patients or people that don't even have these conditions, they should not try to get this vaccine dose before 8 months. That is what you're trying to say.
Exactly. Right now, the booster shot is only authorized for, some people that are immunocompromised. It's not authorized for the general population, not even most healthcare workers. So just hold on. It's not even something to worry about. Right now, all we need to worry about is the people that are unvaccinated. If you're vaccinated, talk to them. Get them to get the vaccine because that in turn will protect you, the vaccine, from coming around. The booster shot, it's not the most important thing right now for really anybody.
Right. Let's now talk about schools, doctor. I have a couple of questions here. As a medical professional, I'd like for you to tell us, what do you think the schools should be doing today in their premises, regardless of the vaccination status? How important do you think it is for them to have a mask mandate for the students and perhaps a vaccine mandate for the teachers and staff? How are you evaluating this whole situation? Because we're talking about millions of children here.
Yeah, that's a great question. The mayor, just recently said that there's going to be a mandate for vaccinations for the education system, and the federal government now has a mandate for places like doctors that work in the VA and other federal organizations for a vaccine mandate. I don't want to comment on a mandate exactly because people have different viewpoints on whether a government should be able to mandate something, but I want to say that in order for us to safely send our kids to school, everybody's at school, all the staff, all the teachers, even the kids are going to have to get vaccinated. Right now, that isn't the case. Most kids are not vaccinated. A lot of adults are not vaccinated. So they should all wear masks. Now, mandates aside, personally, I do believe in a mandate, and I think there should be a mask mandate in school. Mandate aside, everybody should wear masks within these schools because of the low vaccination rates in kids and the high transmissibility, the Delta variant, and because it's the safest thing to do if we want to send our kids back into school.
Right. So let me ask you this. So how do you look at states such as Florida or Texas, where literally every single day right now there are debates going on about masks in schools or about vaccine mandates for teachers, even though that state is surging with COVID-19 cases? How do you sort of, as a professional, respond to that?
To be completely blunt, all through this COVID pandemic, I've been hurt, honestly, by some of the behavior in the South and states like cities like Miami and some of the other southern states. I don't know. You have people dying on one hand, you have surges happening on one hand, but then on the other hand, you have people saying, I don't want to wear a mask and I don't want to get vaccinated, even though the data is there. So they see, because, they say vaccines are not safe. So you see people, dying. You see people getting sick, sometimes your own friends and family. You see minority communities like Black and brown people bearing the brunt of this COVID pandemic. But at the same time, you refuse to do things like putting on a mask. And then you hear some ridiculous things like people are saying, hey, I'm not going to put on a mask because you get low oxygenation from wearing a mask. No, you get low oxygenation from COVID itself. So I don't want to say I'm frustrated, because I'm not frustrated. I'm just saddened. And I hope that whatever we can do to convince you guys to turn the corner. So any viewers with relatives or friends or family in some of the southern states who are resistant to getting a vaccine, just pick up the phone and call them every day. If you love them, if you want to look after them, if you want to have them live a healthful life with many years, have them get the vaccine, convince them every single day, because we know some people may be resistant to the truth, but it's our job to really convince them and help them. So let's not get angry. Let's not get frustrated. It's just sad. And let's just try to push through and help these people understand that they need it.
Yeah, it is a sad situation, but the president is really frustrated over politicians who are banning mask mandates in these states where, cases are surging. But another question about this I'd like to ask you, what do you say to parents that are protesting against these masks in these states? And there are hundreds of parents who feel the need to not wear a mask for their child in their school, and they don't believe in the vaccine. Now, what do we do with those people?
I'm just going to talk directly to you. If you're somebody that refuses to wear a mask, and if you refuse to get a vaccine, and what I'm going to say is, if you're afraid of the vaccine and the effects, I guarantee you it's safe. With this FDA authorization of Pfizer and all the other vaccines coming out, it's safe. What's harmful is COVID. If you want your kids to be safe, if you don't want your kids to get sick and be hospitalized and end up in the pediatric ICU or die, you got to get vaccinated and you got to wear a mask. It's the saddest thing in the world, I can tell you, to watch a little young kid, 8, 9 years old, in the hospital, in the ICU, and not make it because their parent had a certain belief system. It's not their fault. It's not the kid's fault. It's the parent's fault. So please, I urge you, none of us are angry. None of us are, trying to push you. We're just trying to make you understand. If you have questions, ask people that are vaccinated. Ask them, why did you get it? Weren't you scared of X, Y, and Z? And maybe they'll help you understand. If you're pregnant, right? A lot of pregnant people are scared to get it. The FDA, the Pfizer authorization actually said, hey, if you're pregnant, it's safe. They reviewed tons of data of pregnant people, of people that got the vaccine and then got pregnant, and it's safe. Yeah. So I'm telling you, just ask around, try to understand. Don't push people away, but welcome them in and make an informed decision, okay? It's life and death.
It really is life and death. Dr. Anthony Fauci has said that if we can get through this winter and get really the majority of 90 million people who have not been vaccinated, he hopes that we can start to see some good control in spring of 2022. What do you have to say about this little prediction that he's made?
Yeah, that's a fair prediction, spring of 2022. That's a fair prediction. I know that some people are probably a little mistrustful of predictions at this point because they seem to keep putting back and back. But, I also heard Dr. Fauci say very specifically, let's actually not focus on timelines. The timelines are dynamic. It can move back and forth. And if enough people get vaccinated in a quicker timeline, if we look out for each other and if we convince each other and enough people get vaccinated, it's going to be earlier than spring of 2022. So really we have the power. That's just a date, an estimated date. It's not based on 100% factor modeling outcomes. We have the power as a community, as a country, as a people to change it.
Yeah, 90 million people still unvaccinated. I just hope we can reach out to more people and, really change that narrative. Just have a couple more questions left for you. I'd actually like to discuss South Asia with you. I'd like to know what kind of information and news are you hearing from different countries such as Bangladesh, Pakistan, or India. I know they're seeing some surge of cases as well. There's the Delta variant spreading across communities there too. What are you hearing?
Thank you for that question. The Delta variant right now, it originated in India, and it is really affecting the entire population in that region. So just recently, they had their third wave, and people are still reeling from that. Lots of deaths, lots of dying, lots of people without oxygen, lots of people without medicines or hope. And so, in my home country of Bangladesh, there are certain organizations that I work with. In the town of Shatkhira, there's an organization, Nourish Bangladesh, that I work with specifically, and they do good work in getting oxygen and getting medications there. And I encourage viewers, hey, if you know of any organizations or know of anybody working in that area, please donate. Understand that it's a very resource poor setting. Most people live under the poverty line. They don't have oxygen. They don't have access to hospital beds, and they don't have medications. I talk very frequently to doctors and to healthcare workers and to patients and to NGOs over there, and the situation's dire. It's helpless. Right now, here in the US, we're focused on, hey, can we get a vaccine or not? But over there, what they're focused on is so much more than that. They don't even have access to vaccines. They don't have access to the most basic supplies. Young people are losing parents and then are left stranded on the street. People are seeing, their young mothers and young fathers die and saying like, hey, it wasn't their time. People are running around the country trying to get oxygen tanks only to be let down. People are running around the country to go from this hospital to that hospital to get an oxygen, to get a bed and to get some oxygen. And they aren't able to. They just go back home and they want their loved ones die. So please donate. Again, some of the organizations I work with are Nourish Bangladesh, and also in Shatkhira, I work with a great organization. But find your own and please donate. Okay.
Yeah, definitely. How important do you think vaccination in these countries is to truly control the pandemic globally? And following that, I'd like to know, how do you think the developed nations could get affected by the, nations in South Asia, which have a lot of population who may not be vaccinated? What could that, imply later on when we are looking at the global cases of the global pandemic?
Yeah, that's such a good question because we're seeing that right now. The Delta variant is the Indian variant.
Right.
And the reason that started is because so much of India was, unvaccinated. The last time I was on here, we talked about the surge in India and how bad it was. And so the COVID, it mutated within India because of the largely unvaccinated population. And what happened? It just came right back to the United States. If we, as a global population, vaccinated these third world countries, large third world countries like India, or not third world, but vaccinate these large resource poor countries, then we wouldn't have the Delta variant right now because the virus wouldn't have a chance to mutate because it wouldn't have infected so many people. So what we really need to do is vaccinate these resource poor countries like, India, Bangladesh, areas in Africa, Sierra Leone, countries that are having raging pandemics right now. Because if we don't, the virus is just going to keep mutating and mutating and mutating, and it's going to come back to us. And the spring of 2022, it's going to be pushed back and back and back. So, as a global community, we need to be more effective in that.
Two more questions left for you here, Doctor. The World Health Organization has actually said that some developed nations that want to do booster shots should, not do that yet and send out those vaccines to these countries that are, in dire need of it. How do you look at that?
Yeah, I couldn't agree more. Right now, there isn't enough data on when you need a booster shot and when the vaccine starts to wane and at what point, but we do know that it's still effective. So right now, we shouldn't be as a conscious, sympathetic, empathetic global community, we shouldn't be giving booster shots to people because they were born in a rich zip code in this world when people are dying in some resource poor countries and haven't even gotten the first vaccine. So we just shouldn't do that ethically and morally. We need to make sure that everybody, regardless of where you're born, where you come from, who your parent is, has a chance to live, because no one human being has more of a right to life on this earth than another human being. It doesn't matter if you're from Sierra Leone or India or the United States.
Yeah.
So we shouldn't be giving booster shots until everybody has a chance to get that one shot.
Yeah. It's a very complicated situation. My final question to you, I'd like to know prediction for the next month for the world, of what you think is going to happen with COVID-19, and also in the United States, what do you think is going to happen? Because we are going into fall and everyone is worried about that.
Yeah. Viewers, it's up to you. If enough people get vaccinated, we'll stop it. Forget the spring 2022 plan, we'll stop it earlier. The world, if we want to stop these thousands of mutations and transmissions from coming back to us, Delta variant, Gamma variant, this variant, that variant, we need to vaccinate the world. That's just the answer. We know they're safe. So it's up to us, it's up to viewers, it's up to people in the general population. So my prediction is, I don't have a prediction. It just depends on if we could change the global mindset of people. If more people are willing, if people in Florida are willing to get it, the parents and the children, and send their kids to school, then we'll be fine. We'll be out of this. We could start traveling, going anywhere we want. I know a lot of our viewers miss going to India, miss their family, miss their friends, want to go back. They're scared that their family and friends over there can't come over here. A lot of my friends, haven't been back to see their parents in so many years. So we just gotta change the mindset. And my prediction is, if we do, it's gonna be magnificent. We're gonna get we're just gonna be out of this, and things are gonna be great. But if we don't, if we keep going in the way that we're going, I don't know how else to say this, but we're screwed.
Yeah. It's, again, a very complicated situation for all our viewers. Again, vaccines.gov is the website. Dr. Reja, thank you so much for your time today on ITV Gold.
Okay. Thank you so much for having me.